Well, India's task force, the Lancet Commission on COVID, suggests measures to contain COVID-19, and it says that this should be beyond the binary discussion on lockdown. There are a series of area-specific measures that it suggests, as it underscores that the fast-moving pandemic and the second wave took India by surprise. No national lockdown, no insistence on RT-PCR tests during interstate travel, and ban on indoor gatherings of more than 10 people. These are some of the recommendations made by the country's task force to the government of India as it battles the raging second wave. Amidst a growing clamour for a pause, the panel says a localized response is what is required. For this, categorization on low and medium risks and a third category of hotspots would help. Depending on how far they have used ICU capacity, the testing rates and the 7-day moving average in cases, and also the test positivity ratio.
We need to identify these areas and reduce the speed of transmission, especially in areas with high transmission, by doing local lockdowns or regional lockdowns. So therefore, having national lockdown will not be useful in reducing overall. For this, we have given the guidelines.
India's R rate shows one infected person is infecting 1.5 individuals. At this rate, each infected individual is infecting another 1.5 persons. The rate of increase in reported new cases averaged 6.8% for the month of April nationwide, while the rate of increase in reported new deaths averaged 8.3% over the same period. With over 3 million active cases, the healthcare system is under severe strain. It is imperative, therefore, to reduce the continuous rise in new cases. Given the exposure of the fault lines in the medical system, the panel has asked for ramping up supply to prepare for future peaks and to train medical staff, interns and residents and use them as a backup.
India Task Force Lancet Commission, we talk about upping the medical preparedness, for which we recommend training residents and medical students as backup. People can do simple things like taking care of measuring oxygen levels or pooling and optimizing resources, as well as expanding their role of these residents in offering supervised home care.
It has also asked for the need to ramp up genome sequencing to 5% of all tests and said there should be no restrictions on domestic travel, and also says RT-PCR tests should not be required during interstate travel.
We've organized these into 4 categories. The first is around saving lives and combating the illness by ramping up the medical system. The second set of measures is around minimizing transmission. The third set of measures are around containment of the epidemic by ramping up testing and contact tracing and isolation. And the last set of measures are around open communication, using data for better decision making.
Among other suggestions made, a complete ban on gatherings of more than 10 people, closure of indoor spaces, mandatory universal mask wearing in confined spaces and outdoors as well, and focus on cross-ventilation of indoor spaces. It talks about greater community involvement and also credible and regular projections of the trajectory of the pandemic. There is no one single response to the pandemic, is what the task force has told the government in its report. It can take the best performing countries by surprise. The pandemic is a fast-moving one and it took India by surprise. It says because the pandemic is a fast-moving one, the response to the same also should be rather dynamic. In New Delhi, Sneha Mordani for India Today. There is massive shortage of oxygen in the country and steps are being taken by authorities to ensure that supply logistics are not affected. India Today's Ashutosh Mishra is on board the Oxygen Express with these heroes trying their level best to bring our lives back on track.
This is not a regular train. This is Oxygen Express. And India today is on board this life-saving lifeline.
When India battles against this pandemic, the Indian Railway is on mega mission to supply oxygen to several states. I'm on board on this oxygen express from Lucknow to Bokaro. Millions of lives will be saved through these oxygen express.
The train is on a 17-hour journey from Lucknow to Bokaro via Varanasi to refill oxygen tankers.
ये अनुभव क्या अब हमारे देश में संकट है जो महामारी है हम लोग उस पक्ष में काम कर रहे हैं और हम लोग ये रेल एक सिस्टम है ये 24 घंटे काम करती है न रुकती है न थकती है इसलिए हम लोग लगे हुए हैं देश हित में काम हो रहा है भाई किसी की जान न जाए और हम लोग जितनी हेल्प कर सकते हैं उतनी करेंगे।
पहले ही जब संक्रमण फैल रहा है तो आप लोगों को भी डर होता है कभी कहाँ पर इस तरह से खतरा कहाँ से लेकर के आ जाए?
जी बिल्कुल रहता है हम लोग ऐसी हमारी जो है फ्रंट पे हम लोग रहते हैं स्टेशन पे रहते हैं यात्री आते हैं कहाँ से लोग आते हैं हम लोगों को पता तो रहता नहीं कौन संक्रमित है कौन नहीं है फिर भी हम लोगों को काम तो करना पड़ता है ना।
Meet these COVID heroes, the braves who are driving these oxygen trucks to its final destination. They are on a mission to save lives.
तो उनको आप बताते हैं कि आप उस ऑक्सीजन एक्सप्रेस में जा रहे हैं जो लाखों लोगों की जिंदगी बचा रही है।
जी बताते हैं जी। तो वो लोग भी यही कहते हैं चलो आप लोग खुद मतलब देश की सेवा मतलब कर रहे हैं तो इसलिए वो ज़्यादा वो नहीं करते हैं। ये तो डर तो रहता है माहौल ऐसा चल रहा है तो लोग अपनी जान बचाना मुश्किल हो रहा है तो इससे पहले थोड़ा सा डर तो रहता ही है नहीं तभी कह रहे हैं कि आप लोग काम कर रहे हो कोई बात नहीं।
The train's guard is a proud man, calling this special duty a once-in-a-lifetime honor.
ये हमारा तो पहला ट्रिप है आपको सही बताएं हमारे मन से था कि मेरी ड्यूटी जो है एक बार ज़रूर जो है ऑक्सीजन स्पेशल में लगता है
और आज आपकी ख्वाहिश पूरी?
हमारी ख्वाहिश पूरी हो गई। ये बड़ा सौभाग्य रहा कि जो है हमें ये ट्रेन मिली और जो है हम अपनी ड्यूटी आराम से जो है पूर्णतः करते हुए।
Security personnel on board this special express are ensuring that there is no delay or bottlenecks for this special mission.
ये मिशन बहुत बड़ा है ये जो है एक मानवता के लिए मिशन है। ये ऑक्सीजन जो हमारे लखनऊ में जो और आसपास के जनपदों में जो ऑक्सीजन खत्म हो रही है उस ऑक्सीजन की पूर्ति के लिए ये मिशन चलाया जा रहा है।
जीवन में आपको अपनी ड्यूटी में ये हिस्सा कितना याद रहेगा कि आप ऑक्सीजन एक्सप्रेस की हिफाजत के लिए गए थे और आप लोगों के लिए ऑक्सीजन लेकर के आए थे?
जीवन में तो यह हिस्सा हमेशा याद रहेगा कि एक समय था कि हम लोगों की जो है भलाई के लिए या मानवता के लिए जो है हम ऑक्सीजन एक्सप्रेस लेके गए थे और वहाँ से सकुशल लेके आए।
The train reaches Varanasi junction on its way to Bokaro, but the mission continues to ensure people are not gasping for breath.
7 hours long journey on this oxygen express. I now deboard this train at Varanasi junction. The journey of this express will continue where the giant tankers will be taken to Bokaro at the refill plant, which will carry the liquid oxygen, which will save many lives who are battling against this COVID pandemic. Bringing you this ground report from onboard Oxygen Express between Lucknow to Varanasi with Sanjay Kumar. This is Ashutosh Mishra reporting for India Today.
Well, a group of COVID heroes in Chennai have launched a novel oxygen on wheels drive to provide succor to those in need. The Jain Traders body is helping numerous patients in Chennai gasping for emergency hospital, outside hospitals by makeshift oxygen dispensers using school buses. Take a look.
Tamil Nadu is one of the worst hit states battling the second wave. The state currently has nearly 1.19 lakh active cases with at least 2,000 people testing positive every day. And with that, the need for hospital beds and oxygen has also gone up. Patients and their relatives are struggling to find beds, Some are lucky, several others lose the battle, gasping for air. Jain International Trade Organization has come up with an innovative idea called Oxygen on Wheels to help fix the problem. And it's a first of its kind initiative in India. Several school buses which are currently not being used have been modified to accommodate 6 patients each and are fitted with 6 oxygen concentrators and oxygen cylinders to help patients waiting outside hospitals.
We saw a lot of ambulances waiting outside for the patients to get in because there were no beds. So we said till the time, like a transit period, till the patient gets a bed inside, we should create a facility because what was happening is the oxygen level was dropping very, very fast. So we came out with this very innovative idea where all these buses, which are already, Jain institutions run by Jain organizations, these buses are of no use now because the schools are all closed. So we modified these buses.
4 buses have been rolled out for now. The buses are parked outside prominent hospitals in Chennai. The number of buses will soon be increased to 20. The organization hopes to expand the project even beyond Tamil Nadu.
When the patients come to a hospital, they have to wait outside of the ambulance, waiting for a bed to be made ready and especially oxygen. So NGOs have come forward. They're trying to bring something as a bus which is converted to a place where you can get oxygen. In this bus, a minimum of 6 patients are allowed, and there they could get oxygen until they get a bed inside the hospital. Such innovative techniques are also being followed, but the need of the hour when it comes to Tamil Nadu is increasing beds and oxygen points. This is what medicos are advising the state government. With video journalist Daniel Pramod Madhav for India Today.
Not only the Indian Air Force, Army too has been extending a helping hand in the national capital. Army along with the DRDO has set up an oxygen generator at AIIMS to make the hospital self-reliant. Aishwarya Paliwal gets us this report.
As bizarre as it may sound, the need of the hour is oxygen, and the national capital needs a lot of it. 1,000 litres of oxygen production every minute. That's the task the Indian Armed Forces have accomplished at the prestigious All India Institute of Medical Sciences, or AIIMS, in the national capital. Soon after the armed forces were roped in, the Defence Research and Development Organisation, or DRDO, through its industry, has set up oxygen plants at the AIIMS. The idea is to make the hospital Atmanirbhar. With this plant up and running, the hospital will now be able to generate 1,000 litres of oxygen per minute. It will be sufficient for 195 patients every day. Moreover, 197 cylinders of 47 litres can be filled 150 times in just 24 hours.
Right now, the hospital is dependent upon the supply of the oxygen from outside. From the industry, the oxygen is being transported and is being filled at the storage tank of the hospital. Now with this, the oxygen will be generated in the campus of the hospital. The hospital will not be dependent on the outside supply. So as and when required, they can use the oxygen.
Given the acute shortage the country is facing at the moment, the DRDO will set up more plants just like this across the country in the next 3 months.
It will be definitely helpful, and it will be supporting hospitals where there are about 200 patients, 300 patients and all that. It will be very useful. We are trying to overcome continuously, and the industries are working very hard. I think we should be able to meet definitely the 500 numbers in 3 months.
The technology for these oxygen plants is based on the oxygen generation system featured on India's very own LCA Tejas fighter jet. It has been civilianized now for hospital use.
Hospitals across the country are becoming truly Atmanirbhar. This plant is being set up at AIIMS, one of the biggest facilities across the country. The work of this plant is to generate 1,000 litres of oxygen per minute. Yes, that's the astounding work which this plant will now do. The reason is to reduce the dependence that the hospitals at the moment have on outside supply. We are seeing how the number of COVID cases are rising across the country every 24 hours, which is why 500 of such plants will be set up across the country in the next 3 months. This is Aishwarya Paliwal reporting from the AIMS facility in New Delhi with camera person Nasir Khan.
Patients and their families have to run helter-skelter just to secure a bed in a hospital. And health infrastructure across the country is stretched to its limit. More and more people have exuded confidence in treating COVID patients at home with the help of a mini ICU. How does it work really? Yes, Mom.
The country is grappling through the second deadly wave of the pandemic. Oxygen crisis, lack of ICU beds plagues the national capital. Do you know home is where the healing can happen when the patient is past the acute stage but requires intensive care? Healing and recovery is possible without the threat of hospital-acquired infections.
Home ICU is something where you have all the infrastructure, trained nursing ICU staff with trained GDAs and a doctor managing it. So for example, it will have an ICU bed, it will have an oxygen concentrator, it will have a suction machine, it will have a DVT pump, it will have mattresses, syringe pumps, whatever is required to manage the patient, right? All paraphernalia as you can see in the video, right? But there has to be a doctor who's remotely managing it. Any patient who needs to be physically seen by a doctor is not a candidate for home ICU.
Home ICU can get you the most benefits of a hospital ICU at your doorstep. From ventilators to DVT pumps, infusion pumps, equipment that the supervising doctor seems appropriate, and home visit reports as well. A patient gets e-monitored and has regular doctor visits scheduled at home along with nursing assistants that are provided.
During COVID times, we have treated about 10 lakh patients till now. Most of the patients have been treated in home remote management. We've worked with the Delhi government, the Punjab government, the Karnataka government to do that. 85% of the patients don't require anything else. So people should not get panicky and because most of us will get well at home itself.
An ICU at home costs you half of what you'd otherwise pay for at a hospital. An ICU at home can range from 3,000 to 7,000 rupees a day. A hospital ICU, on the other hand, will cost you a whopping 25,000 to 50,000 rupees a day. In New Delhi, Chaiti Narula for India Today.
CT scans are being done en masse in the country given the delay in RT-PCR tests. Well, there is panic and a sense of anxiety leading to more and more patients resorting to this medical tool. But doctors say not everybody needs to go in for a CT scan. And this actually, if overdone, will actually do more damage than help. I filed this report earlier. CT scans now being done to detect COVID-19 and the presence of infection in lungs can do more harm than help. That is the word from top healthcare experts in India.
85% of people have mild illness. They don't need to get a CT scan done. Getting a CT scan done is actually causing a problem for them.
Dr. Guleria, among others, note a trend of increasing cases of people resorting to using CT scans. They say neither should patients resort to this test themselves, nor should doctors overprescribe it.
CT scan, we should understand, is not a substitute of RT-PCR. CT scan, it has its own role in management of COVID, and whenever prescribed by the doctor, it can also alter the management given to the patient by the doctor. So this is my appeal to the general masses: don't get CT scan done on their own whims and fancies.
The scan may actually prove to be more harmful than help.
One issue is that people who have mild illness, suppose you have just in the first few days of illness, you just have fever, your saturation is well maintained, 97, 98, you really don't have much complaints. There is no need for getting a CT scan. You're actually, especially in the younger age group, a young person exposing a young person to a CT scan with its radiation risk is definitely not worth it, and therefore there's no point getting it done.
Even when there is a hospitalization, a chest X-ray should be the first option and not a scan.
I think we must remember that the diagnostic modality of choice is still is not HRCT but RT-PCR, and only in few circumstances where we need to look at the lung lesions, where COVID test may be negative, do we order HRCTs?
So are CT scans good or bad? And should they be done? Yes, only if the doctor advises it. Only if the patient is in a hospital setting or about to be admitted. Mostly required if the patient is moderately or severely ill and not when the infection is mild. Not to detect the infection, and it's not a diagnostic tool. It's not to be done indiscriminately. The risks are exposure to radiation. Radiation can lead to cancer. The exposure to radiation from one CT scan is equivalent to exposure of 300 X-rays. Further, the government has also asked not to go for blood tests to spot biomarkers like CRP, D-dimer, if one has oxygen level at acceptable limits, which is above 94 and is asymptomatic. If you have classic symptoms of COVID, you're feeling unwell and you have done a test and you're awaiting the results, or even if you've got the results of an RT-PCR test and you're showing up negative, then you must not go for a CT scan. Because remember, even asymptomatic patients, experts are saying, will have some patches in the lungs if you're diagnosed with COVID-19. In such a scenario, a CT scan is actually just unnecessary, even counterproductive. In New Delhi, Sneha Mordani for India Today. As monster COVID surge continues across the country, the one question that the entire country is asking is, when will we see the peak of the current wave? Experts tracking the trajectory say while the second wave could start to decline by the month end, a third wave, in fact, may be lurking possibly. Here's more. The second wave of coronavirus has got a vice-like grip on India. The virus has become more contagious and is spreading like wildfire across the country. The one question we're all asking is, when will this end? When will we see the peak of the current wave, which then will be followed by a decline in cases?
I think we're already seeing that the peak has happened as far as the western part of India is concerned, with cases now stabilizing or declining in Maharashtra. Hopefully in the central part of India, that is in Delhi, Punjab and the surrounding states, in the next few days, hopefully in the next 2 weeks, it will stabilize and cases will start coming down.
Experts opine the exact date may be difficult to predict as different states will reach their peak at different times.
So if we talk of the second wave, like we saw in the first wave, there will be different parts of the country which will peak at different times.
Those predicting the trajectory of cases say a nationwide peak is expected by the 7th of May and that there are chances of states peaking differently. That would explain a delay in decline in cases in those states.
The pandemic basically started in the state of Maharashtra. So Maharashtra is already in a decline. You will see that. Now other states started peaking a little bit later because the pandemic traveled across the country. So they will peak perhaps not next week, but the week after that. And a few states are still showing climbing up. So they will peak later still.
But that's not all. Top medical experts say even after the second wave, India will not have the liberty to be lax, and a third wave may be on its way. Well, the government is saying that it appears that Western Indian states of Maharashtra have peaked already. Cases are now on the decline. But states in eastern India like Assam, Odisha and Bengal will likely peak in the next few days. Well, even if the peak is over and cases start to decline overall in the country, which is expected, is what Dr. Guleria says, there is a possibility of a third wave going by the nature of how a virus essentially behaves. And we have to be prepared for the third wave. In New Delhi, Sneha Mordani for India Today. That brings us to the end of this edition. For further news and updates, you can always log on to our website, that's indiatoday.in. You can also download the app